Namaste Vidya, Hamesha Khush Raho Vidya. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in JAYOTI VIDYAPEETH-FHS University, Jaipur. In today's lecture, we are going to discuss about the clinical general physical examination in case of renal disorders. Its clinical aspect. So whenever a patient is coming to us and we are going to examine the particular patient, so what is needed to be examined or how the examination is needed to be done in case of patient with renal disorders. So the complete process is known as general physical examination. In general physical examination, we need to examine the patient from head to toe. From head to toe, all the things that are needed to be examined, we are going to discuss all those things together in the chronological order. So let's start with the general physical examination in case of renal disorders. Now, first of all, whenever a patient is coming to us, first of all, look at the patient appearance, at the complexion of the patient. All right. Then check for whether the patient is conscious or unconscious. So check for the consciousness level. First of all, facial expressions, whether the patient is in agony, in pain, whether he is very much happy or sad. All the things are needed to be observed. Then the complexion, whether the patient is of fair complexion, whether the patient is of dark complexion. Then the consciousness level, whether the patient is unconscious or conscious. If the patient is conscious, whether the patient is following their instructions or not. All these things are needed to be inquired for or to be seen in case of a patient. Is there any disturbance in the level of consciousness? That has to be measured. Then look at the eyes, ears, nose, mouth, neck, and so on, the whole of the body. To examine one by one all the different things. In the eyes, we have to look for the icterus and anemia. These two things have to be looked for. Anemia can be checked by looking in the eyes, at the tongue, in the nails. Just look at the nails for paleness, or doing this test of the nails for checking for anemia, whether the nails are spoon-shaped or koilonychia, or these are normal. So these things have to be examined for. Then you have to check for the nose, ears, any kind of abnormality. Then the mouth. Ask the patient to open the mouth and see whether the teeth are normal, there is any problem or any kind of cavitation. Then look in the throat and both under the tongue. Under the tongue for icterus or anemia. Looking for any kind of abnormality in the mouth has to be checked for. Then you have to check the neck for the cervical lymphadenopathy. You also have to check for the carotid pulsations and the jugular venous pressure. All these things have to be checked for. Then in the axilla, then you also have to check for the left supraclavicular lymph node enlargement for any case of abdominal malignancies. Then you have to check for the axillary lymph nodes, the mediastinal lymph nodes, and then look at the skin. The skin for any kind of abnormality, any kind of scar. The skin has to be looked for any kind of scar or any kind of overgrowth, any kind of marks that has to be looked for. Then you have to check for any kind of deformity from head to toe. Is there any kind of deformity that is present? Any kind of injury mark or anything? Then you have to check in the hands for rubbing of the nails. In the extremities, you have to check for the palate in hands for flapping tremors. In the extremities, is there any kind of swelling, especially in the feet? You have to check for the pedal edema. In the nails, you have to check for any kind of abnormality. The nails are normal, treated, or any kind of growth or deviation has to be checked for. In the eyes, you have to check whether the eyes are normal. The ear, you have to check for the sensory deafness. You have to check this by doing the Weber's test and Rene's test that we are going to discuss in the nervous system examination. So, in the general physical examination, you are looking at the patient from head to toe. You are looking at the face, complexion, the consciousness level, eyes, nose, mouth, ears, neck for cervical lymphadenopathy, carotid pulsations, jugular venous pressure, then left supraclavicular lymph node enlargement. Lymphadenopathy has to be checked in cervical as well as axillary, abdominal, mediastinal level, inguinal lymph node has to be examined. Then you have to examine the extremities, feet, for any kind of edema in the feet. Pedal edema has to be inquired for. You also have to check for the temperature. So this was all about the general physical examination of the patient with renal disease. In the next lecture, we are going to continue with this examination. So this was all for today. This session was powered by digital version 2.0, JAYOTI VIDYAPEETH University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow.